Good morning. Thank you everyone for being here. My name is Sarah Buckley. I am a registered nurse and the political legislative director for CWA 1168, representing almost 5,000 healthcare workers in Western New York, including, sadly, the over 50 that are affected by Kaleida Health's decision to close a number of their facilities: 705 Maple Road, Buffalo Therapy Services, DeGraff Wellness Center, Millard Fillmore Surgery Center, the ENT Clinic, and last but absolutely not least, the Kaleida Health Family Planning Clinic that we stand in front of today. We cannot stand for this. These closures must be halted. The cuts must be reversed. I have a million reasons why this clinic specifically should not be closed. Will this be a burden on my union members who work here? Absolutely. But is that the reason we're standing here today? Not really. Every time I sit down with my union members who are facing their lives getting turned upside down by losing their jobs, every single time what they say to me is like, Sarah, that is not our main concern. Our main concern is our patients. We all have felt like a number in this healthcare system. As healthcare workers, we experience the nightmare of, because being understaffed, of not having enough supplies, we get used to trying to avoid patient eye contact, rushing, ignoring people. And as patients, we all here today have experienced what it feels like to be a number. When you're at your most vulnerable, what it feels like to be ignored or rushed through. This clinic is a treasure. And a healthcare system that throws patients and healthcare workers away, this clinic is a place where patients come for real care. And they have been coming to this clinic in a variety of places for over 50 years. And what real care does, it does not just improve the GYN care that the patients get here, but it improves the entire health of the patients who get care here. There is no substitute for trust and care in your healthcare system. It makes you more likely to seek care other places, to look after your blood pressure with a referral to your primary, to go get that prenatal visit when you're pregnant. Buffalo doesn't always get a lot of nice things, but this clinic is not just a nice thing, it is a treasure. And everyone who has used this clinic for generations, over 50 years, knows that. It is irreplaceable. It is on bus lines. It is accessible to the youth from nearby schools. It also serves men, a thing a lot of these types of clinics do not do. It attends to the unique needs of longtime residents and new immigrant populations. It serves the uninsured. And the healthcare workers here give excellent care. We are calling on Kaleida to halt the closure, to the federal government to reverse the cuts that led to this decision, to the Department of Health to reject Kaleida's application for closure, and for Governor Hochul and the state to step in and bridge whatever gap is necessary to keep this clinic open, as well as the other clinics that we are fighting to keep open. And without further ado, I want to introduce Dr. Lipford, a pillar of the excellence providing care at this clinic for over 25 years.
Thank you, Sarah. Good morning, everyone. Thanks for coming out in support of our clinic. As Sarah mentioned, our clinic has been in existence for more than 50 years. We have been serving multi-generations of patients, youth, men, women, whether or not they are able to provide, whether or not they are able to pay or not. We have always, and we also help our patients help navigate the medical system, which, as you know, can be challenging if they have other issues outside of the parameters of that our clinic provides. I have been, as was mentioned, I've been working in our community with underserved population by the entirety of my career, thank you. and have been so pleased to do so. Our patients are our family. We think of them like our family. We supported them over the years, and they in turn have supported us. We wish to continue to be able to do so, to be able to provide the quality care for communities that are often overlooked. And with these budget cuts that are coming from Washington, Medicaid cuts, etc., communities like ours will be left, will be the first ones impacted and will be left by the wayside with few options available to us. To our patients. As mentioned before, our clinic has always been easily accessible to on the bus lines, on the transit system, and if we are closed, that will also, it'll be difficult for many of our patients to find another place to go. So as I said, we look at our patients as family. We wish to continue to provide our services for them. They have supported us over the years, and we belong together, and we hope to push back on these cuts and these closures. Thank you very much.
All right, doctor.
Next, I want to introduce Judith Thomas, a patient here and a nurse anesthetist.
All right, Judith.
Hi, I would like to keep this clinic open because it's good for men to even come to a clinic. Men do not even like to go to a doctor. So when a man wants to come to a clinic, be seen in a nice clinic that's open to you, open arms to you, and I've been here for some years. My children come here. My granddaughter come here. My godsons come here. I would like to keep this clinic open because this is all we have in this community. So would you please help us keep this community and this clinic open?
All right, Judith.
All right, and I want to thank all the amazing elected officials here that have been fighting already to keep this and other clinics open. And I want to thank Congressman Kennedy for standing up against the immoral budget decisions of the federal government. Without further ado, thank you.
Thank you, Sarah. Well, good morning, everyone. I want to first of all thank CWA. I thank Sarah Buckley for her continued leadership. Thank Judith for having the courage to come tell your story. Doctor, thank you for your leadership here. To Corey Gambini and all of those with CWA, thank you for leading us in the fight here, representing these workers. To Denise Abbott and all of the organized labor unions that are a part of this, standing up for the workforce and standing up for what's right in Western New York, we thank you. Want to also recognize my colleagues in government, Erie County, New York State Senator April Baskin, New York State Assemblymember Jon Rivera, and Buffalo Common Council Majority Leader Leah Halton-Pope. I just got off the phone with your successor in the county legislature, so that's on my mind. The people here that work here are leading our community in keeping us healthy and keeping us safe. And they're doing that care with compassion and empathy. We're into our second week of the Republican shutdown. A shutdown congressional Republicans have chosen to enter into rather than protect the health care of the American people by canceling the Medicaid cuts and extending the health care tax credits that tens of thousands of Western New Yorkers and millions of Americans rely upon. The big ugly bill was a betrayal of the commitment we have made as a nation to care for those in need, to ensure health care for all, and to keep costs in check. I stood with many of the folks behind me here today and rang the alarm bell months ago. We made it clear, under no uncertain terms, that the big ugly bill passed by congressional Republicans would result in hospital and healthcare facilities closing across our community and across our country. Premiums skyrocketing across this nation, a degradation of healthcare services, and millions of Americans losing their health insurance entirely. Tragically, the result is that people will die. And today we're here because those predictions are becoming a reality in real time. The facility behind us here today, the Kaleida Health Family Planning Clinic, is a prime example. Patients from around the region come here for caring, thoughtful, and confidential comprehensive GYN care, STI, HIV testing and treatment, contraception, colposcopies, and so much more. And as many of you know, I come from the healthcare world myself as an occupational therapist. I worked for over a decade as a healthcare practitioner, working with children and seniors, people of all ages with disabilities and healthcare needs, work that I deeply cared about and work that deeply shaped the work that I do today. One of the things you quickly learn as an occupational therapist is how critical the full continuum of care is. It's not just one clinic, one doctor, one nurse. It's the whole picture. It's the holistic patient. And it's facilities just like this that do that vital work each and every day in our community. And now this facility is slated to close in November, a direct result of the Medicaid cuts that have made it unsustainable to stay open. A direct result of the big, ugly bill that put a gaping wound in healthcare across this nation, forced upon us by congressional Republicans. Sadly, it's just the tip of the iceberg. Rural hospitals continue to struggle, with nearly a dozen in New York State alone at risk of closure. And in just a few weeks, letters will be going out to Affordable Care Act exchange users informing them of next year's rates that will skyrocket because Republicans failed to extend the health care tax credits. Those are increases that could be the difference between paying rent or keeping your health insurance, refilling your prescription, or buying your kids' school supplies. For weeks now, House Republicans have chosen to stick their heads in the sand while federal workers go unpaid now, and we speed closer and closer to the brink of the health care cliff. And it's all avoidable. Republicans have the House, they have the Senate, and they have the White House, and they have failed to lead this nation. And they have failed the people of this great community in this great country when it comes especially to their health care. Their failed funding did not extend the enhanced health care tax credits. It did not reverse deadly Medicaid cuts. And it did nothing to reduce the cost for everyday Americans. Facilities like this and the amazing workers who provide care inside of it are why I'm fighting to cancel these cuts. Stop the shutdown and protect the health care of millions of Americans, including thousands that depend upon care right here in Western New York. This is not a Democratic or Republican issue. This is not a red or blue issue. This is not an urban, suburban, or rural issue. This is an American issue. This is about all of us. This is about our health care, no matter who you are. Something that every single one of us needs and deserves. Something that our loved ones rely on for their wellness. Congressional Republicans have failed to make life more affordable for Western New Yorkers and all Americans. They've made it more difficult, more expensive, and more dangerous, and yes, more unhealthy. This facility may be one of the first, but tragically, unless we cancel these cuts, it will not be the last. It's time for Republicans in Congress to work with Democrats in a bipartisan fashion, cancel these cuts, protect our health care, make life more affordable, end this shutdown, and keep great facilities just like this one open. Thank you.
Thank you.
Next, I want to introduce New York State Senator April Baskin, who's been fighting alongside CWA workers for over a decade.
All right.
All right, Senator.
Thank you, everyone. Thank you to the community members, to the media, and to my elected colleagues who are joining us here today. Thank you to CWA and all of our organized labor who are leading on this issue. A lot of times we identify our organized labor and our bargaining unions as advocates specifically in the space for workers' rights, which we do need across this country. But on this particular issue, their passion and their drive is around the residents of this community, of our region, who will be out of decent humanity without health care. And for that, I am eternally grateful to you all. Thank you for your sacrifice. Thank you for your hard work. And thank you for being the people who really put people first.
That's right.
God bless you. I have some notes here, but the comments of my predecessor, our great congressman, who is in this fight every single week, leaving his children, leaving his wife, leaving his parents, leaving his family, going down to Washington and getting quite bloody, emotionally, I hope not physically. But if you got to do it, we know he can handle himself. For your leadership and your passion, always speaking out on this issue, and to the great assemblyman, my colleague in government, Jon Rivera, and our Common Council Majority Leader, Leah Halton-Pope. Thank you all, too, for fighting for this community. Dr. Lipford said something that was very, very profound when she said the communities impacted first by these cuts. The communities impacted first. When are we going to talk about that first? Okay, 1 block away, not even a block, you could just step across the street a couple steps and you're going to be in the heart of the Fruit Belt community, a historically Black community here in the city of Buffalo, who I honestly today send my condolences. That is a community of homeowners, of grandmothers, of children, of educators, of civil servants, of residents, our neighbors, who year after year after year have government and big business making decisions about what happens in their backyard. And they are the ones who are impacted first at all times. They never ever really get that first conversation or that first knock on the door, that first seat at the table. Correct me if I'm wrong, council member. But we're always pushing to make sure that those residents have a voice about the decisions that are being made in this surrounding area. And here we are today. You think anybody knocked on their doors and asked them if this was the closest clinic to keep their hearts beating, to keep them feeling alive, to keep their children healthy? I don't think anybody probably knocked one door. We could go over there right now, news cameras and all, and ask, did you have a say in if a clinic, a healthcare clinic that is just steps away from your home should be removed from your community? The first to be impacted, like the doctor said. When I first started in local government as an elected official, you all know I started in county government. At the onset of 2019, I was 1 year into being a county legislator, and the county did this cancer study, and they found that there was a cancer cluster in Erie County. You know where the height of that cancer cluster was? The Black community. Years after that, we were faced with COVID-19 pandemic, uptick in the 14215 zip code. Where is that zip code? The historically Black community. Year after that, domestic terrorist decides that he wants to get in his car, drive to a community and terrorize Black people. 10 lives robbed from us, 13 wounded. Just who was the first impacted? Our community. Your words ring strong, doctor. The first impacted. We don't want to talk about that. 6 months after the mass shooting, one of our most deadliest blizzards in recent history hits Buffalo, New York. 51% of the victims, people of color. First impacted, our community. Our community is sick and tired of being the first impacted, the first on the chopping block, and the first to go. And the congressman said it so eloquently, and I know he could say it so more viciously, but he's a gentleman, but I'll do it for him. Those of you that identify with being loyal to your political party over decent humanity, you are going to feel this too. You may not be historically the first impacted, but this time around, you will feel it. And no one will care who you vote for on election day, or what color you represent, or what party you align with. Your grandmother, your children, and the people in your family who you know damn well are on social services too. People who look like you, your neighbors, not everybody in your family, can afford to have health clinics robbed, it's coming to you too. The time is now to put this pettiness and this silliness that is bleeding out of Washington aside. And I believe that organized labor and the residents of Buffalo, New York, can be the first to be the trendsetters in this country to reverse it. We do not want this clinic shut down. Thank you all.
Thank you, Senator Baskin. Next, I want to introduce the impressively hardworking, shining first woman president of the Western New York Area Labor Federation, Denise Abbott.
Shining, I love it. Those that don't know me, my name is Denise Abbott. For more than 20 years, I've been an ER nurse at DeGraff Memorial Hospital, and I serve as the Health and Safety Director for CWA 1168. Today, I am here as the president of the Western New York Area Labor Federation, AFL-CIO, and I have the honor of representing 140 local unions and their 145,000 union members and retirees here in our region. Whether it's working in a factory or on a farm, workers behind a desk, or behind the wheel, organized labor and the working class are under attack. The Trump administration is taking away health insurance from 17 million children and families most in need, and refusing to fix the cost crisis every person with health care is about to be hit with. More than 500,000 federal workers have had their labor rights illegally stripped away. The CEO of Kaleida, who makes more than $3 million a year, puts our community's access to care on the chopping block rather than reduce his salary or fight back against Congress's cruel Medicaid cuts. Every day, working people worry about our jobs, our economy, and our futures. Here, right here, in the heart of Buffalo, racism and redlining have created disproportionately negative effects for the health of Black, brown, and immigrant residents, and this closure will only make outcomes worse. But it does not have to be this way. Our solidarity here in Western New York is as strong as anywhere in the world. We know that every worker, no matter what, deserves the freedom to join a union, the fairness of a family-sustaining wage, and the security to know that one day we will be able to retire with dignity. When we fought for an 8-hour workday, they called it unrealistic. And when workers were killed on the job, we asked for changes. When we said we deserve health and safety measures because our jobs shouldn't kill us, they listened. They said the bosses would never give in, but they did. Why? Because our collective power has made it happen. Today, all of labor stands in solidarity with these patients and family members, and we stand with all the workers at hospitals and facilities like this one, now slated for closure under President Trump's attacks on American health care. Their fight is our fight. This might be a small clinic, but its feel for this neighborhood, its work in this neighborhood is mighty. At the table and on the strike line or in the streets, we will always fight for the power of working people. Thank you.
Thank you. Next, I want to introduce Thaliea. And this brave young woman, as a patient here, represents dozens, if not hundreds, of patients that come here. I have a stack of handwritten letters about what this clinic means to many of these patients. But I want to thank you for actually getting to the mic.
Good morning, everyone. I'm Thaliea Borrelli, as she just said. Kaleida Health agencies matter to me the most and should not close because Kaleida Health has helped me and been through my journey with me for over 7+ years in this company. The company is the only company I've been connected to, and the staff knows me and our connections through the service. The service has been a delight, and if there's anything I can do to help this journey stay open and this company stay open, I'll do it. And that's all that matters to me.
Thank you. I also just want to take a minute to thank some folks who are here. My very own president, Corey Gambini. And I want to thank the Assemblywoman Crystal Peoples-Stokes, who is not here, but has sent folks here. So thank you, Mark Boyd, for being here. Appreciate it. And I want to next, who am I introducing? I want to next introduce New York State Assemblyman Jon Rivera, a longtime friend of labor who's been fighting along with us to keep these clinics open. Thank you.
I want to thank everybody for coming here and shining a light on this. You know, at the end of the day, when I talk to folks that either have worked here or somehow working in this field, it's universal. I hear it from folks that have been good and present in this community for decades, and they all say the same thing, that this is about the patients. The folks here at CWA are doing amazing, incredible work across this region and really across this state. And what's showing more than anything else is when I talk to people, they're not saying, well, I don't know what's going to happen to me. I don't know where I'm going to go. I don't know what's going to happen next. Every single person tells me, I'm worried about the patients. Because at the end of the day, that's what we're here for. That's what we're worried about. We're worried about people getting care today that won't be able to get care tomorrow. And why is that? Why are we looking at closures of clinics and hospitals? Because this is one thing, but we know there's more to come. Next is it will be in other parts of the inner city. Next it'll be parts of rural counties. We know where there is already trouble accessing healthcare, those are the places that are going to get closures first. At the end of the day, why is this happening? It's happening because the federal government, this Congress, this president, this Senate would rather talk about cutting health insurance than doing something else. Because they care more about billionaires and their tax breaks. They care more about making the wealthiest more wealthy. They care more about faceless, emotionless, careless, reckless thoughts than they do about people suffering right now. If it wasn't for the health care afforded to me in my community, I wouldn't be alive today. And everyone here can say that. I'm so thankful for the health care we have. I'm so thankful for the work that people do here. I'm so thankful for everybody that's doing everything they can to make people healthy and safe and give people completeness in their lives. So here we are facing this ugly thing, and I want to give a big, big, big thank you, a sincere thank you to Congressman Kennedy. The fight he's fighting is a fight that is uphill, certainly, but it is a fight that is worth fighting. You know, we get elected into these offices, called in a moment to do a particular thing. And I see it in our council member, and I see it in our senator, I see it in our congressman, I see it in everybody. I believe that fate has called us to make a difference, make a change. And if this is the fight we have to fight, there is no more noble fight than this fight. Not just to keep people working, but to keep people healthy, to keep people safe. So I'm ready to fight every day for the rest of my life on this, because I know this is a fight worth fighting. I stand together with CWA, I stand together with organized labor to make sure that not just that this clinic isn't heard and the patients are heard, but that every clinic's patients are heard. Because we are not going to be silent in the face of greed, we're not going to be silent in the face of lack of transparency, and we're not going to be silent in the face of heartlessness. So thank you very much. Let's make this happen.
Thank you. Next, I want to introduce a true fighter for her community and longtime health advocate, Buffalo Councilwoman Majority Leader Leah Halton-Pope.
Good morning, everyone. Can you hear me? I have a big mouth. I want to thank my colleagues in government, of course. I want to thank the physicians who work here. I want to thank labor who sacrificed their time. I want to thank the patients who have trusted this location for over 50 years. Right in the shadow of Kaleida, Buffalo General, and Oshai Children's Hospital. We all understand what this clinic means to Buffalo, so let's be clear. This is so much more than just providing health care. It provides access. It provides trust. It provides dignity. For over 50 years, generations of families have come here for help. Not just women, but men, young people, immigrants, and people without insurance. people who may not feel safe to be seen anywhere else. This is a place where you can walk in and be treated with respect and leave with answers, not judgment. The services offered here are life-saving and life-changing. Pregnancy tests and other counseling options, STI and HIV testing and treatment, birth control and emergency contraception, HPV and hepatitis vaccines, prenatal care and mammogram referrals, education and outreach in our schools and community centers. This clinic has been more than a provider, it's been a teacher in our community. And it's about to close because some people who have been elected, much like we all have been, have decided to put profits and politics over the people we were sent here to serve. That's unacceptable. Educating young people about their health and their bodies and their choices. They build confidence, preventing disease and saving lives. So when Kaleida and the federal government and others, you put them in a position where they say they have no choice but to close a clinic, they're not just closing a building, they're closing doors to access, to trust, to equity. They're closing a safe space that has been here for more than half a century. That's not acceptable. And this is happening at the worst possible time. STI rates are still rising, and syphilis and others at alarming rates. Black women who look like me, are still dying from childbirth at 3 times the national average. Black people who look just like me and people of color are still losing their lives due to cancer issues. This is not acceptable when you have a location that's been right here in the heart of our community for 50 years. Not acceptable. Families are struggling with healthcare costs and limited options. This decision, to me, it makes no sense. So we should be investing more in clinics like this other than shutting them down. And let's not be clear, let's not be mistaken. I want to be clear, this is not just happening in the inner city. This is also happening in rural communities. Communities where I don't live in a rural community. I live right here in an urban community. But where you shut down a community healthcare clinic right in the heart of the city of Buffalo, you're also probably shutting one down in the communities with people that do not look like me. This is coming your way. You'll be looking for people who look like you. And by the way, y'all voted for these people. Let's be clear. It matters where we use our voice. It matters where we use our voices, where we vote. How important it is that we speak up and stand up for people who stand up for us. I am proud to stand with Senator Kennedy, and Congressman Kennedy. I am so grateful he's in Washington every day fighting for us, standing up, taking on the good fight. But it's not just him. I'm grateful for my partners in government who work on the state level with Senator Baskin and Assemblymember Rivera, because they now have to go back to New York State and say, listen, where the federal government has failed us, New York State has to stand up and do the job. That's what we're here for. I'm proud to stand and with the labor who's been carrying this country since the beginning, covering us. We've got healthcare workers who stand on the front lines, who sacrifice their time, their talents, their treasure, because let's be clear, no, they don't make enough money to do what they do, to make sure that we have access to health care. Listening to staff who's dedicated their careers to serve this community, that's what we should be doing. Expanding care to reach those who fall through the cracks and not cutting them off. That's what we should be doing. Buffalo, this country, this state, we deserve so much better. Our residents deserve so much better. My constituents deserve so much better. And as a council member and as a proud daughter of this city, I'm standing here to say we will not quietly accept this closure. We are calling for the federal government, for New York State, and for Kaleida to halt the decision immediately. This is not acceptable to us at all. We want to make sure that every single person who needs access to care gets it. And I'm here to fight until I can't breathe anymore. Thank you. God bless you.
All right. Thank you. All right. Next, thank you so much. Next, I want to thank the support that our City Action Buffalo has given these efforts. Thank you so much. Thank you, Leighton. And I want to introduce Aminah Hardy. Please come up here. Thank you for speaking.
Hello, everyone. I am a patient of family planning. I have been a patient for 22 years. I have seen families retire here. Dr. Lipford has been taking care of me for 22 years. And when I came in for my appointment and was notified that this place was closing abruptly without even an explanation, I asked Dr. Lipford, well, where are you going? She said she didn't know. So that prompted me to call Class Action Buffalo, Mr. Layton over here, and we took it to the streets. Kaleida, we need answers. We need answers immediately. You guys got a $50 million grant, given to you guys for Oshai, and you guys are talking about funding? I don't understand. I'm devastated. My community is going to be hurt behind this, because when I was a young child, a young teenager, and I needed care, I walked to the clinic. I was on Medicaid when I came here. I am no longer on Medicaid. Everyone's not on Medicaid. The funding is not ending. We need you guys to step up and do something and stop this shutdown. This is going to affect people behind me, people above me that's older in age, and it's going to hurt. And it's going to hurt bad, and we're going to need you guys to stay open so that these families and people in my community continue to get the health care that they need. It is important. Trump, I don't even want to say his name. This big bill is very, very ridiculous, and is very disheartening to me as a person who pays a premium every month for me and my child. To the people who don't have the money to pay for it, where are they going to go? I cannot go to Jesse Nash. I can't go to that clinic. You know why? Because they don't answer the phone. When Dr. Lipford and this family planning come, I call, I can get in immediately. That's the problem. That's the problem a lot of black communities are going to run into. When we try to go outsource the patients to other places, they're not going to be able to see us. Who's going to take care of me? That's the question I leave you with. Kaleida, who's going to take care of me now? That's all I have to say.
Thank you. So in closing, I just want to say I have been absolutely privileged to come into this clinic and meet with the workers and Danielle, who can't be here right now. Every time a patient walks by, she says, tell Sarah, oh, she is, thank you, Danielle, for all your work here. Every time a patient walks by, she says, tell Sarah what this clinic means to you. And every single person stops, and they are like from every age group, from every walk of life, and every one of them has stopped and told me what this clinic means to them. And that is why I can tell you that it is a treasure. People have been coming here for generations. Oh yeah, I come here, my mother has come here, my grandmother has come here. This place is a treasure. We cannot let it close. We are calling on Kaleida to halt the closure, to the federal government to reverse the cuts, to the Department of Health to reject Kaleida's application for closure, and to Governor Hochul and the state government to step in and bridge that gap to keep this place open.
That's it.
Sorry. I guess, any questions? I want to be done, but I guess I have to ask if there are questions.
Yeah, you detailed called on Hochul to help to stop the Hochul. Can you just be really specific about what exactly it is you think they should do to help?
Well, I believe that the Department of Health is a New York State agency. So on the one hand, we are calling on Governor Hochul to intervene and also call on the Department of Health to reject the application from Kaleida for closure. And also, this might be unprecedented, but we would love to work with Kaleida Health to get some kind of emergency funding to keep the clinic open. If that is why it is being closed, then we're asking for a no-holds-barred help here to keep this place open.
I'm sorry if you already mentioned this, but exactly how many jobs have been lost here, and how many patients do you serve every year, for example?
Dr. Lipford?
How many patients, how many workers?
That are losing their jobs. Mm-hmm. Well, let's see. Our clinic is small, so we have, myself and I have a nurse practitioner, and then a couple. I would say there's maybe about 10 or 11 of us, staff, as it were, and we see, as I said, on average 10 to 20 patients a day. So however that works out, at least. I mean, we're a small staff, yeah. So thousands over the year. Mm-hmm. You're welcome. Sorry, I didn't.
No, perfect. Thank you. So understated. Thousands. Any other questions?
I think I have a point. Let me just say one thing.
Okay, please
Sorry.
do. Please do.
One thing that when I was speaking to employees, like the doctor that works
Introduce
here
yourself.
earlier. Oh, hi, my name is Leighton Jones. I'm the communications coordinator for Our City Action Buffalo. I have been working with patients as well as employees from the Family Planning Center since last week. And initially when the news broke and the patient found out, she called me and she was like, oh my God, I don't have a place to go anymore, right? So imagine your family and your friends not having their community center to walk to in their community, right? But one of the points that was made was that this center has money in the budget until next year, until the end of next year, right? So like, it's not a thing that it needs to close this November, right? It's intentional that they're making these decisions to impact Black and brown communities that look like us, right? And so this big, beautiful bill is not looking so beautiful for our community. And this is the reason we need to say something and make sure we show up in these capacities that we are. And so I appreciate everyone for showing up today. I just think that point needs to be made that there is money in the budget and they're choosing to close it this November instead of allowing it to go on until money runs out. You know what I mean? At least allow the employees to have a safe haven to go to, the patients to have a place to go to on a consistent basis until you can figure out how to, give them or suggest a place that they should go to, right? That's really messed up. Thank you.
Thank you. All right. Thank you, Leighton, and thank you for your support. Any other questions? All right. Thank you. Thank you all.